Report that Kiambu County, the second most populous county in Kenya, has successfully resolved or have successfully negotiated with the striking nurses, bringing to the nurses strike, of course, the strike to 10 counties from the 11 counties that we've read earlier. Now, moments ago, KTN Sophia Onuno spoke to the chair of the Council of Governors and Kakamega County Governor, Wycliffe Oparanya, who has said the mess being witnessed in the health sector is a creation of the national government.
But Oparanya is adamant that the human resource component of healthcare should not be returned to the national government.
Now, Oparanya says counties will only be able to meet the nurses' demands if the national treasury allocates them more funds. Let's listen into what he had to say earlier.
Do you think the HR function for the health workers needs to be returned to the national government? Remember, at the advent of devolution, there was an argument the health workers made that they felt there were no structure in the counties, it should be left to the national government. And listening to you now, it appears as it was a problem there, and it continues to be a problem, perhaps not take it back.
My friend, I can tell you these problems have been inherited from the same place that you are saying that we should now return it. In fact, all these problems that we are enjoying, we are having now at the moment, they are national government's problem that we are trying to solve. But talk to any mwananchi at the local level. He will tell you that healthcare has improved. At least me, I can tell you that in Kakamega County, healthcare has very much improved at the moment. But the human resource systems have already been put in place. What we need is approvals from the Salaries Remuneration Commission and get more money from the Treasury. We will be able to implement this issue.
Yeah.
Because, as we say now, you are talking about counties. What about national government?
So
they're also on strike, isn't it? Yeah.
One of the issues they were raising, the nurses, is that they feel like they're being played around with, ping pong, in that when they come to the counties say, well, the money is coming from the national government treasury. Then treasury will say SRC is the one deciding. Then there'll be the CRA question. Then now there's the labor. So that there's almost like no backstop. Do you see that sense of frustration?
What I feel at the moment, and I can tell you because I just took office the other day, what I think that this issue was not dealt with properly. There has been enough time to sit for us to look at this issue, but I think someone slept on his job somewhere. But however, now we have it with us.
Who slept on the job?
No, we have it now. I don't want to blame someone here, but now we have the problem now. Tomorrow, I've told the Cabinet Secretary in charge of Labor that we need to sit down together, be updated on this issue so that we can move forward. I would not want people again to suffer as we suffered last year for several months because of non-payment of what we have agreed to do.
Yeah.